We've been living with COVID-19 for 2 years and counting, and still there's not a clear consensus on measures to curb the spread of the virus, especially when it comes to mask mandates. California had some of the strictest masking requirements, and Alameda County in the Bay Area just reinstated indoor masking. My next guest lives in LA County, and in his latest newsletter, he discusses how to end mask mandates once and for all. Joining me now is the author of that piece, Richard Hanania, author of the Hanania newsletter and president of the Center for the Study of Partisanship and Ideology. Richard, thanks for joining me.
Thanks, Robbie.
So what is your strategy to erode the kind of mask mandates that we see returning in various places? I know you, like myself, really don't like wearing them, don't want to wear them. And you have come up with an idea that I was waiting for it to be proposed. Talk about what that is, how actually disability law and the kind of requirements in the law for people who have disabilities could actually be used for people who don't want to wear masks anymore.
Yeah, so under the American with Disabilities Act, if you're an employee or you're a customer and you have a disability, the businesses basically have to make a reasonable accommodation for you. Now, what's a disability and what's a reasonable accommodation? That's what courts and lawyers and judges and regulators are for. Me personally, I've spent the last 2 years, at least for 1 year since vaccines became available. I thought the mask mandates were ridiculous, basically trying to not comply with the LA County mask mandate. This means, going to certain stores and not others. This means, avoiding, certain kinds of, even like the dentist, I've tried to go less often. I mean, so there's all these things that I'm doing. And by any measure, you could say that this is a form of disability. You could say it's autism, it's some kind of inability to function, it's anxiety. I mean, we see these things. We see basically a disability under American with Disabilities Act is whatever a doctor is willing to attest to. So basically, if you want to end the mask mandates, all you really need is at most a doctor's note, a doctor to say, look, this disturbs you, put some medical label on it, call it ADHD, call it anxiety, call it whatever, and you should be free and clear. The disabilities laws are even stronger than that would apply, actually, because you don't really need the doctor's note most of your time, according to DOJ guidance. If you say you have a disability and a business can reasonably accommodate you, and specifically, they've cited like grocery stores as something that where you're in and out very quickly, they shouldn't ask for any kind of documentation or anything like that. So for schools or something like that, for kids, you might need a doctor's note. But saying just I have a condition, that should work in most places. And once a few people start not complying and it sort of becomes normalized, they give up on enforcement. This is what happened with like therapy animals here in California. They used to not allow dogs into restaurants and stores. Enough people were able to get a prescription for anxiety or disorders or whatever they had, and eventually they just gave up on enforcing the no pets rule. So I think something easily could happen with mask mandates. People just have to take the initial step.
Well, right, and a lot of people could probably claim, reasonably, I mean, I feel this way, that having to communicate with people while we're wearing masks is very difficult. I don't understand people very well when I'm wearing a mask and when they're wearing a mask. I don't know what kind of issue that is. I'm hard of hearing. I have to rely on social cues to kind of understand people. So it's legitimate. I am not advocating. Maybe you are advocating actual dishonesty about it. But I don't think people should try to get their doctors to make up things. But as you point out in the newsletter, right, the therapy animal, that kind of stuff. People have already gone to incredible lengths to kind of force society to play ball with, I need to bring this animal with me everywhere. I need to do this thing. I need to do that thing. So why could it not be extended to the masking conversation?
Yeah, I don't think dishonesty is necessary here or anything like that. I mean, the disability is subjective. It's always expanding. I mean, there's court cases. There's alcoholic. Can you fire an alcoholic if he drinks on the job? I mean, these things are always being litigated. I think that people who dislike masks, they tend not to come from the demographic who doesn't like to think about themselves as having a medical problem. I'm like this. I've been really, really bothered from masks for the last year or two. I don't like to think in terms of this gives me anxiety. I need to go to a doctor or something like that. I just think in terms of this is a bad thing that I really, really hate. But that's good enough under the American with Disabilities Act. If it bothers you enough, it's a disability, and take advantage of the law here, because this is going to go on forever otherwise. I thought after Omicron, maybe we were finally done. But look, in California, we can't even get through the summer without masking. So forget about winter, forget about an unmasked Christmas for the rest of our lives. I mean, this can't go on, and I think this is the quickest way to do something about it.
Yeah. But another problem, though, we'd encounter is, are there going to be doctors, actually willing to, write a note or say, yeah, this person has anxiety or has a communications disability, you can't wear a mask. You have to, the medical community seems pretty, obviously you can find exceptions everywhere. They don't speak with one unanimous, it's not just like Dr. Fauci speaks on behalf of the entire community or something, but there is a lot of buy-in to the idea that the COVID mandates and the restrictions are important among the medical community more generally, given, how team-based we are. They ended up on Team Blue, so that could be an issue.
Yeah, it could be. I mean, but look, doctors advertise their services. There's doctors who are known for being more friendly towards this or that. I see doctors all the time on TV rallying against COVID restrictions. I always think, stop going on TV, just go back and start writing all your patients' prescriptions. So I think, you're right that I think this is why this hasn't happened so far. It's because the medical community, they'll give you an anxiety animal or whatever. But yeah, they're on Team Blue and they dislike the idea of helping Trump supporters do something they think is unreasonable. But it doesn't take many, and I think doctors who see the craziness of permanent masking, I think they could potentially form a business doing this.
Yeah, it seemed like a few weeks ago, when there was a kind of rapid end to the mask mandates in most places, in many schools, in many city-based mask mandates here in D.C., ours finally went away from the third and better be final time. January, February, March, this was happening. It seemed like it was partly because Democrats had done some internal polling or realized that perpetually masking people had enough of it, and it was going to make them unpopular. And I thought that surely is going to be the end of it if they think they're going to be doomed because of it. But now we are seeing some creeping back mask mandates in places in California, college campuses, still some of them, I think, masking people or encouraging it during sports activities, things of that nature. Are the Democrats are they just open to paying this political price, I suppose, and will keep doing this because they can't tell the kinds of epidemiologists or the people who recommend this that, sorry, it's enough?
Yeah, it's hard to know. The polling is very strange because you look at just poll results and people are very pro-COVID restrictions. But then when you look at how Republicans are doing in elections, they seem to indicate that people dislike the COVID restrictions. And I think in California on the West Coast, there seems to be more support for them than elsewhere. The Democrats, Gavin Newsom, didn't seem to be hurt during the recall. Also, in LA County here, and it's like this in a lot of places, basically the health commissioner is the sovereign. The LA Board of Supervisors, they could overrule her, but they generally don't. So they've given this power to this one public health official, and that takes it out of the hands of people too. I don't know. It might be just regional. California's just might be more accepting of mask mandates, but the rest of us who have to live here, would like the option to go back to a normal life.
Indeed. Well, Richard, thank you so much for joining me today.
Thanks, Robbie.
We'll be back with more Rising right after this.